Good morning, everybody, and thank you once again for tuning in and listening to us. I am so excited to be here today to talk about a really interesting, great project that's a collaboration between AdCare Educational Institute, the City of Worcester Division of Public Health, Spectrum Health Systems, and, of course, the Hanover Theatre. And in the studio with me right now is Derek Brindisi. He is the Director of Public Health for the City of Worcester. Welcome.
Great, thank you. Good morning, everyone.
So this is an exciting project that we're talking about, but first, before we talk about the project, tell us a little bit about some of the things that the City of Worcester's Division of Public Health is really concerned about.
Well, thank you so much. This project really ties in nicely to a lot of the things the Division of Public Health and many of its community partners started a year ago. Last year, we developed a community health assessment, working with folks from UMass, our other partners at St. Vincent's Hospitals, the 2 health centers, and numerous community-based organizations. We developed a health assessment to really identify what are some of the most pressing public health needs in our community. And we went through a strategic planning session last fall where we identified 5 domain areas where we really hope to have an impact on the community to improve the health. Dr. Hirsch, our Commissioner of Public Health, set the stage early on when he said our vision should be to be the healthiest city in New England by 2020. So we're headed down that path, and these 5 domain areas include healthy eating and active living, substance abuse, which we'll talk a little bit more about this morning, access to primary care as the 3rd, violence and injury prevention as the 4th, and the last domain area is cross-cutting, and we focus on health equity and trying to close those health disparities in our community.
That's awesome. What a really great agenda, and I'm really excited to see what we all look like by 2020. I'm thinking fit, fabulous, fun.
Absolutely. Trying to get people to be more physically active, to recognize that health and wellness should be a part of everything they do, whether where they work, where they live, and where they play. It's really trying to move that agenda forward. And we also know that it's cross-cutting, that it promotes economic development, it enhances public safety, and it enhances and helps achieve academic success in our school system as well. Absolutely,
just like live theater.
That's right.
And the arts. So tell us a little bit about the project we've alluded to.
So there's a movie that the City of Worcester and AdCare and Spectrum are all co-sponsoring. It's called Anonymous People, and it ties in nicely on a couple different fronts. One, first and foremost, September is National Substance Abuse Awareness Month, and this movie will help us raise awareness to the issue of substance abuse, which again, the City of Worcester's Division of Public Health over the years has really tried to do as much as they can to try to lower the number of overdoses in our community, trying to prevent individuals from accessing prescription drugs. So for example, in Massachusetts statewide, the overdoses is the leading cause of unintentional deaths.
Wow.
And Massachusetts is, when we started out on this project 6 years ago, was the only state that recognized this as a public health issue. Most communities were focusing on underage drinking and vehicular deaths as public health issues. And what we found in Worcester specifically over the last few years is that there have been 587 heroin overdoses, Whoa. And 25 of those caused death.
Wow.
And our department, again, had been working with folks like from Spectrum and AdCare, community-based organizations throughout the community to try to limit the number of overdoses. So getting out there, talking to organizations in neighborhoods on what overdoses mean and why are they occurring in our community. And an outgrowth of that was we found on the rise, we did a youth survey 2 years ago where we found all of our youth, not just in the city of Worcester, we did actually a regional youth survey. So the data I'll share is more on a regional level, not just Worcester, but that 18% of our youth reported using prescription drugs on a fairly regular basis. 18%, that's high. That's almost 1 in 5. And we also found that 5% of our youth reported having used heroin at least once in their lifetime. So the issue of substance abuse is not just for adults. It's actually a major contributor to poor health amongst our youth. So again, working we look at ourselves, the department, more of a convener and a facilitator in an organization to help raise awareness of these issues. But we rely on Spectrum and AdCare and other substance abuse treatment providers as those service providers to get out there in the community to help us in this effort to try to lower, whether it's overdoses or try to prevent the use to begin with.
It's amazing. And those statistics are so sobering. As parents, sometimes we hear that heroin use is on the rise, and we hear these rumors that it's really inexpensive and accessible, but those statistics are staggering to me.
And it's absolutely true. So when we look at the numbers as far as costs, and again, the Worcester Police Department, who I haven't mentioned yet, has been a really phenomenal contributor to this effort, given the fact that they have boots on the ground. They're seeing this on a fairly regular basis. And what they tell us is that a bag of heroin on the street is about $13.
Wow. I don't know what that means exactly, but it sounds cheap.
But we'll compare that to what another type of opiate, so a prescription opiate like Vicodin, Percocet, that's $80 for one pill on the street. So what we're finding when we look at our numbers is that our youth are starting to engage in pills. And it's very easy to engage in pills because it's easy to find these pills left at home unprotected in your grandmother's medicine cabinet, or maybe your parents had a surgery and these painkillers are left in the cabinet, and our youth they're hearing about their friends using it, they're wanting to try it, and these opiates are very addictive product. And so what happens is, and heroin is also in the opiate family, so these youth are starting to pop pills, they become addicted to the opiate itself, they can no longer afford the $80 on the street, but they can afford the $13 a heroin. So we're seeing our youth go from pill popping to heroin use because of the cost alone. And so again, really trying to do a lot in the community, especially in September being Recovery Month. We have a prescription take-back day. We've been working with the DEA's office for the past 4 years. We do it in April and we do it in October, where we try to organize opportunities for the community to bring back their prescription drugs that they would ordinarily be left in the home. It would be left unattended. Children overdosing and things of that nature. So that's going to be happening as well in October, again, trying to get pills off the street and have a safe way for disposal.
Well, that's great. And so if people want more information about the work that you're doing, where should they look?
Certainly they can call the department at 508-799-8531, or they can also go to our website where we have a lot of this information already pre-populated on the website at www.worcesterma.gov/health.
That's great. And so this all relates back to behind the scenes at the Hanover Theatre, because we are going to be doing a screening, a free documentary film about the over 23.5 million Americans living in long-term recovery, and many other topics. We're going to get to that in a second. And that date for that is Thursday, September 19th. The doors open at 5:30 at the Hanover Theatre, and it starts showing at 6 p.m. This is a free event, first come, first seated. There is more information we'll be putting on our website, so check it out at thehanovertheatre.org. Derek, thank you so much for joining us.